alive until they're ready to save their own lives. Things to look for: if you see somebody who is not doing well, you want to make sure you check up on them. Things to look for: if somebody is purple, blue, extremely pale with a gurgling noise, the darker the skin of the individual, they're going to go gray rashy on you. Those individuals are in respiratory distress. You call 911 immediately. But if you're not sure, you need to check on that person. Make sure that you check the surroundings to make sure that there's nothing there, needles or anything that you might hurt yourself with. You want to make sure that you can reach out to the person and say, hey, are you okay? If the person is not responding, you want to do a loud noise to try to wake them up. If they don't respond to that, either tap shoulder or shake a foot. If that doesn't happen, then you want to make sure you do what's known as a painful stimuli, which a lot of times they tell you to do a sternum rub, but that's kind of personal and in your face. So what I generally tell people is if you pick up that person's hand, you have the distance of their arm and your arm of space between you both. Take that index finger, sit it on your index finger, and with your thumbnail, you're going to dig into the center of that fingernail and press as hard as you can. It is uncomfortable and painful. At that point, if you get a response, that person's hand is going to draw back. If you don't get that, that person is unconscious. You call 911, give clear and precise directions. And to administer the Narcan, the most common product looks like this. The other one is naloxone, which is the generic, which is a peach-colored box that comes with an atomizer that you have to put together. But this is the most common product. It's easy to use. You peel, take it out of the package. You don't have to do anything to it to prep it. All you have to do is always remember either the quote-unquote symbol or what I call bunny ears. Thumb goes here, fingers go here. And the easiest way, if you want to, this is a demo, but easiest way to do it is thumb there, fingers there. You're going to put it in the nostril and you're going to press. Discharges instantly. It's one juice on one nostril. It takes roughly 5 to 8 minutes to fully kick in. Usually after 3 or 4 minutes, if the person is not waking up, if you have a second dose, you want to give it to them. But the other thing to keep in mind is if they're not waking up and they're still purple, they're not breathing, you want to do rescue breaths. In the kits, there is a face shield. You open it up, it looks like this. Very simple. Make sure that before you ever do rescue breaths on anybody that you check to make sure that nothing is obstructing the breathing. Sometimes you may have somebody who either has a piece of candy in their mouth when they overdose. Sometimes it's a possibility that the cap from the syringe that they were using might still be in their mouth. There's gloves in the kit. Put on the gloves. Make sure you roll the person on their side. Sweep the mouth, put them back. Easiest way, face shield, match the nose up with the nose. Pinch. The back of your hand on the forehead, the other one on the chin. You're going to tilt back. That opens up the airway. You're going to do strong breath. 1 Mississippi through 5 Mississippi. You're going to do 1 strong breath every 5 Mississippis until that person starts to breathe. They wake up or the ambulance gets there, whichever happens first. Once this person wakes up, make sure that if they start to breathe and they're not fully woke, you want to put them on their side. Never leave anybody on their back who's overdosed and being resuscitated. Sometimes have a tendency to throw up, and they could asphyxiate in their vomit if they're laying on their back. Put them on a rescue position on their side. Once the person wakes up, you need to inform them. We administered Narcan. Your system is temporarily blocked for the next 30 to 90 minutes. Do not use anything for at least 2 hours. A lot of individuals who are using substances, especially opiates, think that Narcan is a system flush. It is not. It is a receptor blocker. The drug is still present, you just can't feel it because it's blocking it out of your receptors. Let them know your system is temporarily blocked for the next 30 to 90 minutes, the drug is still present. If you happen to go and use more, you're not going to feel the effects of it because you're blocked, and there's a good probability that when the Narcan wears off, whatever caused the original overdose with what you put on top could be a fatal dose now. So it is important to always inform the individual. I never tell anybody that I called 911 because there's still that paranoia that 911 means you call the police and I'm going to jail. I wait till the ambulance gets there and I go, by the way, the ambulance is here, you should have them check them out. Try not to be all over the person when they're waking up. Keep in mind that that person overdosed and they don't realize that it happened, and when they wake up, if there's a crowd over them, they're probably going to freak out on you. So I generally, when their eyes start opening, kind of step back, let them acclimate to whether the ceiling or the sky, depending on where they're at. And then when they start looking around, say, are you okay? And then go from there with the conversation. Did you want to administer Narcan to Manny? Sure. So, plain and simple, like I said, thumb on the bottom, fingers around the nozzle. You're going to put it into the nose and just press.
We're assuming that went through all the other.
Yes, we're assuming you've already called 911 here in the area, checked on the individual, you established that they are in need of Narcan, and you would be,
You heard what he said. Everything's been clear. I'm not rushing it.
no, you're not rushing. And you would put into the nostril and then just press. And it's that simple. Once you press it, it discharges instantly. Each dose is one dose. If you have more than one, obviously after 4 or 5 minutes,